I will continue with the presentation on sharp joint action, and after that we'll have the session on IHR strengthening for better preparedness and cross-border health threats after this talk. But now it's my time finally to start to thank all of the participants and give compliments to everybody who has been supporting us. We've had in our advisory board, we've had ECDC, DG Sante and other directorates from the Commission as well, WHO Euro and many other stakeholders supporting us throughout the whole 4.5 years. And of course, my biggest gratitude goes to all our work package leaders who have been taking care of the real substance work within sharp joint action. But I will give you a very short intro to sharp joint action. To most of you, this is very familiar things, but nevertheless. Some basics. Our two biggest aims were to strengthen the implementation of Decision 1082 on serious cross-border threats to health, and to support EU-level preparedness and responses to health threats and the implementation of IHR. Well, as you've heard today, and you will be hearing more during these 2 days, both of these big health security framework regulations are now, they have been already revised or are under revision. So very much has been happening during these last years. But nevertheless, our aim is still the same: strengthen ability to prevent, detect and to respond to biological outbreaks, in addition to chemical contamination and environmental and unknown threats to human health. And this is not only within EU, but we have also sharp partners outside of the EU, EEA, and other partners. And once again, this is where we started. If you look through the IHR public health core capacities, which were the areas that our joint action was aiming to respond. There are several areas which were within our very, very vast scope of our sharp joint action. And I have highlighted here some other joint actions which were, or areas of work which were covered at that time by other joint actions. For antimicrobial resistance, there was joint action on AMR, and now you are probably many of you are aware that there's another very huge program on AMR in the preparation phase. Then for the biosafety and biosecurity, joint action on terror, especially on the deliberate release of biological agents, it's ongoing and led by our Norwegian colleagues. There was joint action on vaccination, so this was also excluded from our, or not within our scope. Plenty of national laboratory system surveillance and such areas. Now there's United for Surveillance, which is working on surveillance. To mention some other areas, also points of entry, there was joint action on healthy gateways, which was working on points of entry for several years, which was one very important, and we collaborated with them as well, led by our Greek colleagues. Actually, out of these core capacities, only the radiation emergencies were not applicable, since they are not part of the IHR, but many others were really within our scope. I have stolen this slide from Mika Salminen when we started. This was one way to understand the area as well. And as you can see, health security is really covering several areas of not only human health, but also animal health and environmental health. And all our functions, we had really vast scope, as mentioned earlier, but many of our actions were within these areas. Some more basics. It's a huge joint action. We have 30 participating countries covering almost 95% of the whole EU population. 26 associated partners, which were mostly public health institutes such as THL, maybe more even specialized on infectious diseases. And in addition, there were 35 affiliated entities, which means that under the main partner, they had connected institutes within their countries. In addition, we have 10 collaborating partners. We started in our actions in April 2019. Actually, we had the kickoff and the first steering committee meetings during the summer 2019. And it was supposed to be a 3-year joint action. We are very grateful to the DG Sante and the Commission because we applied for 1-year extension when we saw that the COVID pandemic was really hitting us hard. And then they also approved us 6 months more, so altogether 1.5-year non-cost extension until end of September 23. And today we are privileged to have all our work package leaders here. So you will hear more about the core work packages. We are continuing soon with the work package 5 on IHR core capacity strengthening, led by Sweden, and then we'll have all the work packages presenting their work during these days. So just to reflect a little bit what we have achieved. I'm not going into details because you really have the work package leaders telling you during these days what we have achieved. But here we are. This is kickoff meeting from July 2019 from Vilnius, Lithuania. And as you can see, we are all happily smiling and happily unaware what would hit us within just a few months or half a year. So everybody relax and really enthusiastically looking for the future. But what happened then? We really didn't know what was hitting us. And as Mika mentioned earlier, that no one could have never predicted that the European borders would be closing during the pandemic. But this is also one way to look at it. I took a glance at our grant agreements, which we were preparing in the beginning of 2019, end of 2018. And we recognized 13 critical risks for the implementation. And we have I have not listed all of them, but we have the usual suspects such as insufficient human resources and lack of data from departments or low quality of the deliverables and so forth. We did definitely not see that within the very area of our work there would be a pandemic. I don't know who could count odds for that, but really not foreseen. Our main concern was maybe, it's number 13, you don't see it and no worries, was maybe Brexit. Because UK was, there was Brexit ongoing and we have the United Kingdom leading 2 work packages, and that was maybe our most biggest concern, that they would then maybe not be able to continue their work. But much did we know. So to wrap up our challenges and achievements. Challenges, of course, COVID-19, and COVID-19. That was the biggest challenge. Most of our partners are public health institutes, so they were responsible in preparedness and response and for the national response. Also, very strong laboratory network. Of course, we're all extremely busy. And almost for 2 years, we had great delay or even full stop in some of our actions. We had a lot of changes in personnel of some partners. We had huge lack of human resources by some partners. Many of us were fully busy with own responses. And of course, one which we actually did recognize beforehand was the vast scope of the joint action and large amount of the partners. So this was very hard to handle, and also so wide scope does not always help the implementation. But despite the challenges, I'm very proud to say that we are soon about to reach our goals. At the moment, we have 16 of our 33 deliverables ready, and many more are in the pipeline and very soon to be finalized. Some of them are already circulating within the steering committee and the stakeholders and advisors. And we will hear more from the work package 4 on integration in the national policies and the sustainability, that we have already identified 10 priority outcomes of the sharp joint action, which could be incorporated either nationally, regionally, or even on a European level. So I am very proud of what we have achieved, even though we had very difficult times. I'm sure that we all do agree on that. I'm definitely not going to read these through, but I'm just giving you a short glance what are the deliverables. There are 33 deliverables and in addition 40 milestones. But these are the main outcomes of the joint action. And as you can see, there are several of them already ready. On, for example, on chemical threats and chemical safety. Also work package 5 and 6 on IHR strengthening and preparedness and response planning. There are already few reports on that, and many to come. New deadlines have been set for June, so it will be very busy summer, especially for us as coordinators, but all of us. But I'm very positive that we will finalize all of these in time. Of course, some of the deadlines are set in the very end of the joint action final reports. And just to remind you, we are putting all of the deliverables public, which are to be public. There are some restricted ones because there might be something on the national security or other security issues, but basically you will find them on our web pages as soon as they are finalized. And here we go. We started with SMILES, and this is actually our last workshop or congress which we did together. It was in World Congress on Public Health in Rome, Italy, in May. And we are still smiling, or at least trying to smile after all this. I don't know about you, I have some more wrinkles and gray hair after the pandemic, but that's life. But nevertheless, I'm very happy, and it's been a pleasure to do collaboration with all of you. And I'm thanking you very warmly, all our work package leaders, all our partners, and of course, all the stakeholders and advisors who have been supporting us during these years. So with these words, if you have any questions, please contact us, and I'm hoping that you are enjoying Helsinki. You brought the nice weather with us, so it will be nice and sunny for the 2 days while we are sitting here inside. So thank you all. Thank you very much.